We'll hang out for a while. It's my wacky. We gotta catch a break soon because Grandpa needs a haircut for sure. Well, yeah, me and Phil are sporting that '70s look, man. We're the Mod Squad. All right, are y'all ready? Good evening, and thank you for joining us. Things have evolved very quickly in the situation with the safety of our schools. Yesterday, we were given the authority to our local health department to make decisions on delaying school openings. Dr. Phil Huang serves not only as the director of Dallas County Health and Human Services, but also as the health authority for the county. He is the health authority also for all the cities, the city of Dallas and all the other cities, with the exception of Garland and Richardson, who have their own health authorities, but who are going to work closely with us in this endeavor. I'm going to turn it over to Dr. Huang in a moment to explain to you the decision-making process and his decision to delay in-person opening of schools. A decision that is not an easy one, but one that I and the vast majority of people that we have spoken to today agree with. I want to commend Dr. Huang for being very collaborative in this very brief time that we've had this power with our Dallas County Health and Human Services, less than 24 hours, in fact. He's talked to a lot of people, and I want to pledge to you that we're going to be even more collaborative in the future. I've reached out to teacher groups and principals and other groups, and we want to hear from everyone, because this is not a one-time decision. There will have to be decisions made. Unfortunately, with the situation that we have here in Texas, there'll be many decisions to be made as far as what is in the best interest of our kids. We have put together a committee. The committee is yet to meet, but the committee will be chaired by an eminent child psychologist. We recognize this is more than just keeping teachers and students physically safe, that the COVID is taking an emotional and psychological toll on your kids, that there's a challenge with nutrition, safety. There are special populations, special needs, and other populations that must be thought about, and I pledge to you we will spend hours a day working to make sure all those populations have the best outcome that they can have. Here's Dr. Huang to explain to you the decision-making thus far and where we are.
Good evening. As we always start these things, we are today announced 1,027 new cases, so we've got 37,996 reported. We've had reported 16 new deaths today, which is tied for the third highest number in a single day of deaths that we've reported. And it's in that context, really, that we've been looking at this issue. We've seen record numbers of emergency department visits, hospitalizations, ICU admissions in Dallas County over the last week or so. So, given these numbers, it's really imperative that we do what's best for the safety of our school children and our school employees. This afternoon, as the judge mentioned, we actually had a Zoom call with almost all of the superintendents of all the public, private, and charter schools across the county to discuss students returning to campuses for in-classroom learning. We discussed in depth, really, the challenges that schools are currently facing. Many expressed concerns about reopening their classrooms for in-person instruction and the safety of teachers and staff and students. So I'm issuing this public health order today that delays in-person instruction for all local public and private schools until September 8th, 2020. Now, this order allows schools to begin remote instruction on schedule, but it does also ban all school-sponsored events and activities such as clubs and sports until the school systems resume in-person instruction. Also, the order includes a provision that 2 weeks before beginning in-person instruction, schools must share their reopening safety plans with parents and the public before at least 2 weeks before in-person instruction begins. So I think those are the main things about this. Again, as the judge mentioned, there are a lot of different issues related that we recognize. It's a hard decision. We heard the comments from the superintendents and took them to heart, but we feel that this is what's best for the safety of our children and staff in schools at the present time. So open it up for questions.
Questions, anyone?
Say that. Summer camps? The question was about summer camps, and so it would be all school-sponsored events and activities. So if they're sponsored by schools or school systems, then those type of activities would fall under this order.
Right.
When you say that the schools are going to have to submit a plan 2 weeks prior to opening, can you elaborate on that? Who's going to be examining that plan? Is there going to be approval or disapproval process?
So the statement, it says that they'll develop a written plan for resuming on-campus instruction and extracurricular activities, and they submit that to the local health authority, which is me, and make the plan available for parents and general public. So we will review those plans and provide feedback and approval, essentially.
What is the situation we would need to be then in order for you to feel comfortable, confident of the students returning back to school? What if we're still where we are right now? I mean, we got to be optimistic, but what if?
So the question is, are we confident that September 8th is the magic number date to return, sort of something like that, or?
Sure. Yeah. What if we're still looking at the same amount of COVID-19 cases we're seeing right now?
Sure. The question is, what if we're still looking at the same numbers as right now, let's say September 8th? And as this order goes until September 8th, because given the data and where we are now, we don't feel that it's safe until that time. It's not, and as the judge mentioned, there will be advisory group that's being convened to then look more closely at all of the issues, make further recommendations, and also we'll have time to see how the numbers progress, how the spread continues in our community. If it slows down, that will be good, and it'll be part of the information then to make further decisions. So this only goes until September 8th, but as we talked with the superintendents, it's recognizing that things may change, and we'll also get this added input from these advisory groups.
What exactly, what kind of implementations are you looking for in those plans, right? When they submit those plans, what exactly are you looking for to say, yeah, this is good to go?
The question is what we're looking for in those plans, and I mean there's a lot of guidance and CDC guidance for reopening schools safely. Certainly things like having some of the structure in how the classrooms are set up, not trying to minimize mixing of the classes, keeping the cohorts and the classes separated, that there's provisions for 6-foot physical distancing, that there's adequate plans for hand washing and hand sanitizer available. But all of the plans also, again, for other infection control practices, for monitoring of staff and students, for symptoms and temperature checks and how that would be implemented, those sorts of things that are part of the CDC best practice guidance.
Does that plan require the schools to have a plan for the parents who don't feel comfortable sending the students even then? Or is that maybe something to ask the district?
The question is, does the plan have to have something for the parents or?
For the schools to have a plan in case a student doesn't feel comfortable returning to school, maybe continue online.
The question is, will it have to have a plan for parents who want to continue to have their students continue online? I think that would certainly be part of the proposals and plans that we'd be looking for. But again, I think we'll also be getting some of the advisory committee recommendations during this interim period in the meantime also of some of the best practices to be looking for.
Will this apply to any combination daycare, pre-K that's going on right now, if they have affiliations with the school district?
Question, does it apply to any pre-Ks or daycares right now? I mean, it applies to those that are associated with public and private schools. So those programs that are associated with public and private schools then would be affected by that.
Any other questions? Thank you all very, very much.
Thank you.